So next I'm going to talk about the history of the HIV epidemic, and this is courtesy of the AIDS Education and Training Center of New York and New Jersey. So on June 5th, 1981, 5 cases of gay men from UCLA were diagnosed with pneumocystis pneumonia. And so this was in the period of 1980 to 81, 5 young men, all active homosexuals. It's so funny, I haven't seen that word in so long. I didn't realize it was only like 30 years ago. Treated for biopsy-confirmed pneumocystis pneumonia at 3 different hospitals. And 2 of the patients died. And so and again, going back to the early 80s, I was living in New York at the time, but you know, there was definitely concern and not necessarily panic, but you know, worry in the LGBT community especially, and the community at large. What is this? Is this just, you know, affecting gay men? Is this affecting everybody? So there was a lot of worry and fear. And then shortly thereafter, a month later, now there's 26 cases. And then December 10th was the first scientific paper that kind of looked at the disease. Other early developments. In 1982 is the first time the word AIDS is coined, and it's acquired immune deficiency syndrome. The first cases are now being reported in women. The first transfusion and vertically transmitted cases are reported. So then public health started changing their whole protocol about transfusion because of this development. In 1983, isolation of a retrovirus from a patient with AIDS by Montague's group. And this is when, because of this significance, they are able to start making what's called antiretrovirals, which was one of the first medications used with people diagnosed with HIV. And then in 1984, they developed the test and were be able to detect HIV-3 in patients at risk for AIDS. In 1985, the FDA approves the first commercial HIV antibody test. 1986, the National Institute of Health, or NIH, establishes the AIDS Clinical Trials Group. So now finally some research is happening to find out what's going on. And a lot of this research probably wouldn't have been started. Now notice, this is 4 years later. So ACT UP was doing a lot of protests at the time all over the country saying, hey, how come there's no monies being put into the gay community to research what's happening? If this was with the straight community, we'd have these trials happening in 1981. So, so notice there's a 4-year lag there, and a lot of that, unfortunately, was the prejudice against the LGBT community. In 1987, AZT is the first antiretroviral approved by the FDA. And then, in terms of 1981 to 1987, this is the proportion surviving months after diagnosis. So basically, the proportion surviving kept increasing after the introduction of AZT, the first antiretroviral. 1991 to 92, more antiretrovirals approved. Then there's sequential monotherapy, which is kind of a blood, not quite transfusion, but medication that works on the blood. The Ryan White Act Care is passed, and here's Ryan with his mother. He died shortly thereafter. I think it was 93, 94. Then in 1993, a one of the studies came out with there's no difference in the clinical endpoints over 3 years with early versus deferred AZT. So basically, even though maybe a client had HIV but did start AZT right away, he or she still had a really good chance of survival. So it meant that, you know, because a lot of clients that had HIV and that still do don't even know it, but this research was promising in the sense of, oh, even though maybe they got it 10 years ago, there's still hope that they could live a much longer life. In 1994, AZT, a study shows, can reduce mother-to-child transmission, and that dual nucleoside therapy is better than monotherapy. So basically what that is that instead of just one medication, they did like a combination, and that had a better effect on the disease. And then in 1994 to 95, they ended the dual combination therapy because it had such horrible side effects that it was preventing or interfering with clients adhering to the regimen, but it also, clients were ending up dying of different side effects instead of the disease itself. So they stopped it altogether. 1995 to 96, then HIV viral load becomes available, and clinicians could directly assess the effect of the antiretrovirals on a client's HIV status. And the first protease inhibitors are introduced. Okay, got that. So then the era of ART, or the antiretrovirals, comes into being. The paradigm, so it's aimed to achieve suppression of HIV, and it's also aimed at striking the HIV-related morbidity and mortality. And aggressive treatments, hit hard and hit early. So that's when there was really a push in the LGBT and also minority communities to get tested. And it's still a mandate today, especially among young people, because that's where, unfortunately, the HIV rate keeps increasing, whereas population over 25, it's decreasing. And then there's mathematical models that suggest that 3 years of ART can actually eradicate the virus. It's still there, but it's called undetectable. And then here is a slide about mortality versus the ART utilization. The deaths if someone is not taking ART, the deaths are lowering, in other words, because of being on ART. HIV eradication, so then there's what's called the realism stage, that it's not possible, even with the current therapy, that you just, again, once someone has HIV, you always have it. Even though the viral load may be undetectable, it's still there. HIV is a chronic disease, such as emphysema. It just gets worse over time. And then there's long-term toxicities. So there's a fat redistribution as one of the side effects of ART. There's also insulin resistance, diabetes, increased lipids, which means bad cholesterol. And then in 2000, the AIDS conference, there's momentum to get ART to the developing world, such as Africa, South America, because of HIV just exploding among the population there. Between 2001 and 2006, There's more regimens being implemented. There's more interest in treatment. There's more simpler daily regimens with fewer pills. And that was a huge problem up until probably 2005. I mean, I remember clients, you know, they'd have like 20 different pills a day. It was insane. And, you know, it's hard enough to keep someone adhering to a regimen with maybe only 1 or 2 pills a day, let alone 20. So with the new medication coming out, and the research showed that it was just as effective, there were fewer pills and a lot more optimism over the newer drugs. Then in 2007, 2009, there's approval of a new class of drugs. However, there was a setback in HIV vaccine as the NIH pulled out their funding, saying there's lack of efficacy. And basically, that meant that it really didn't, it just wasn't prudent financial-wise because uncircumcised men had higher rates of HIV acquisition, and also they were talking about clients not using condoms as another reason. And again, ACT UP got involved with this because they were like, well, hey, other communities you give money to, they're not necessarily, you know, behaving the way you want to behave, but you still have studies funding them. So the setback wasn't for long story short. And then, as stated earlier, the earlier the onset with ART, then the increased lifespan. So then an interesting development came out with what they call the Berlin patient. So this one man, a 40-year-old man, basically, long story short, there was no active replicating HIV detected, and 20 months after he started or was put on ART, he stopped. And they're like, hey, so maybe AIDS can be cured. But he was kind of an anomaly because they haven't really been able to find any other cases, at least not so far.